Time is running out. The deadline to enroll in a healthcare plan through the ACA is only 2 months away from today. August 15th is the deadline. So what are you waiting for? We have experts to help you navigate that process. Catherine Sevier is with AARP of North Carolina. Morgan Campbell is with Alliance Insurance Services, and Laura Packard is with Get America Covered. They're all here to answer your questions, healthcare related, whether that be Medicare or ACA or just your regular health plan. You can text us a question, 336-379-5775. Remember, this is text only, so please don't call. Again, text only. All right, Laura, let's start first and foremost with some news that folks might be hearing later on in this week when it comes to the ACA healthcare plan and the Supreme Court.
Okay, there has been a court case that's been working its way through the court system for a couple years now, and it's finally gotten to the Supreme Court, and the Supreme Court will be releasing their ruling any day now, but by the end of the month for sure. And they will be deciding whether the Affordable Care Act stays in place, whether part of it is dismantled or all of it. But don't panic. Don't panic yet. Pay attention, but don't panic. And also, whatever happens, contact your legislatures in Congress, your senators and your representative, and make sure that they know that healthcare, affordable healthcare, is important to you.
All right, so if there are folks at home, and we just heard Laura say, don't panic, but as you are on the other side of that, you are on the insurance company side of that, what are you seeing that maybe lends you to believe like, hey, really don't stop your health insurance like right now?
No need to stop the health insurance right now. We need to wait to see what the Supreme Court is going to rule. And every insurance carrier that participates on the ACA, they have a backup plan. They're prepared for whatever could come down.
Right, and I know people at home are probably like, well, does that mean that I should sign up, that I shouldn't sign up, that I should wait to sign up? Laura, your thoughts on that?
Well, if you need health insurance and if you have a body, you need health insurance, then you should get covered today, especially if you're eligible for a cheap or free insurance plan, because then what are you losing?
All right. Well, let's take a look because we want to make sure everybody knows what the new dates are when it comes to enrolling in healthcare. Because again, we know that, lawsuits and things, they drag on for a while. So we don't want you missing any kind of enrollment date. So the new dates for the ACA enrollment, the deadline is now August the 15th. And that's been put off a couple of times, but at this moment, it is August the 15th. And what happens if by August the 15th you haven't signed up, or if you haven't changed your healthcare or made any different elections? What happens then?
So what happens after August 15th, you're basically in a small lockout period, because then we go into open enrollment, which starts November 15th and runs through December 15th. So there's still another opportunity right around the corner.
Right, but you would have those a couple of months, either A, without any kind of coverage, or maybe coverage that you're paying too much for. For folks at home who are like, you know what, I know I can go online and I can probably look at the 1,000,001 plans that are out there, but I really don't know what's best for me. Morgan, kind of explain how it works when people are getting their insurance and how an insurance provider can help.
So what we can do is we can look at the plans for you. We can look at your medications, figure out which formulary they're going to fall in. We can make sure that your primary care physician and any specialists that you see are in the network. You would not want to get into a health insurance plan that you had to give up your primary care physician that you've had for 30 years. You're not going to be happy, and you're not going to have a pleasant experience with that.
All right, so you might want to try an insurance company. It's not that you pay them. You don't pay them to help put you in an ACA plan. So that is something that is really important to know. If they're asking you to pay them, you need to walk right out that door, because they are not supposed to be paid by you. They are paid by the insurance company. All right, Catherine, let's go to you, because you are able to also answer questions about Medicare. And the question that we get every single time is, when do I have to sign up for Medicare?
So you have to sign up for Medicare as you approach your 65th birthday. So 3 months before to 3 months after, or the month that you actually have your birthday. So you want to go in and sign up. Most people automatically get Part A for free, and then you'll be asked to sign up for Part B. If you don't sign up for Part B when it's offered at that point, you need to have only one good reason for not doing it, and that's because you have employer insurance that is legitimate for coverage for your Part B. Otherwise, sign up, because if you don't, you'll pay a penalty when you try to get it later.
Okay. All right. So we are getting some questions here. Oh, you know what? We got 30 seconds. So I'm going to table that question because there's no way they're going to answer this in 30 seconds. We're taking your text questions. Make sure you text us at 336-379-5775, and we'll be right back. All right, welcome back. We are here with Morgan Campbell, Laura Packard, and Catherine Sevier. They are answering your questions about healthcare enrollment and also Medicare as well. This one is a Medicare question. They say, does Medicare pay for hearing aids?
Medicare Advantage programs sometimes do, not all of them do, but regular Medicare does not.
Okay, this is good to know. All right, this person says, I'm 55 years old. I have no income. Do I qualify for any kind of health coverage? I'm thinking that's a Laura or a Morgan question.
There's a possibility to not have any income. We take the household income. So if he's married or she's married, that income can be accounted for, and then she would qualify for a health care tax credit.
Okay.
Depending on their circumstances, they might be eligible for Medicaid, or if they lost their job, they might be eligible for having their health insurance covered through the American Rescue Plan. It really depends on their situation.
All right, this question is, I have stage 4 cancer and did have Medicare, but then they switched me to United Healthcare. Is there a difference? Maybe why did they do that?
So it sounds like as you went into Medicare that perhaps they moved you into a Medicare Advantage program, which is managed by United Healthcare. But Medicare can't switch you out of a government program. They may have advised or asked you to switch to Medicare Advantage from regular Medicare. And with stage 4 cancer, it may be because your pharmacy benefit was better under Medicare Advantage.
Did you have anything to add to that, Morgan?
I think probably what happened is he was placed in a Medicare Advantage plan. Mm-hmm. And those are certainly great plans as well.
Okay. All right. This person says, my grown child is now 27 and is kicked off insurance. He does not have a job. What should he do to get insurance?
So he can always buy what we call a catastrophic plan, which is a plan that has limited benefits, like you can get 3 what I call sick visits a year. Your preventative care is still covered at 100%, and that's going to be at a much reduced lower rate than a typical full-blown health insurance plan.
Okay. This person says, just to clarify, I signed up for Part A Medicare at 65, but since I'm still working and have insurance through Blue Cross Blue Shield, I did not sign up for Part B. When do I need to do that so I won't be penalized?
As soon as you retire or lose that employer benefit, you need to sign up. And there is a window there, so do it immediately, or do it as you anticipate getting ready to retire.
All right. Laura, this person says, what about people who are already enrolled in the ACA healthcare plan? Do we need to re-enroll again?
Well, at the end of the year in the next open enrollment period, you'll want to look over your options for next year. You may or may not be auto-enrolled in the plan you have now for next year, but it's always worth the time to shop and make sure your plan is best for you.
Yeah, because things change, and just because you had something last year doesn't mean that you want that same one this year. This person is asking.
You want to make sure you update your income too.
Mm-hmm, that's a good point. This person is saying, I have Medicare A and B. Can I get a supplement insurance as well?
Yes, absolutely. Medicare does not cover anything or many things 100%. So you may want to get a supplement to take care of the portion that Medicare does not cover.
All right, this is, does Medicare offer mail order prescriptions?
Depends on your if you're a Medicare Advantage, possibly. Standard Medicare, no.
All right, this person says, what do you do at 62 for insurance help?
At 62 with no Medicare in place due to disability, you would go through the marketplace and get a tax credit if you qualify for one and purchase your health insurance there.
Okay, and this person says, do I sign up for Medicare Advantage at the same time I sign up for Medicare A and B, or at a different time?
You sign up for either Medicare A and B or Medicare Advantage. So you have to make a decision when you do sign up. But again, 65, 3 months before, 3 months after.
All right, this person says, if you don't take Part D because you have employer coverage, then when do you have to get it without a penalty?
You can get Part D without a penalty. Once your employer coverage ends, you immediately need to have a Part D up and running the very next day.
Okay, all right. We have taken many a question. This last one is, my birthday is December 5th and I'll be 65. When should I apply for Medicare? 3 months before, 3 months after. You got 7 months to do that. Thank you for sending your time and expertise. We appreciate you spending your time and expertise. Thank you for taking those questions to the text. If you missed any of these or you want to hear them again so that you can be sure of what you heard, we want you to go to the Two Wants to Know section.